Orza, dean of the OCU Meinders School of Business, joins us now, fresh off back surgery. So if you see Vince go, ooh, that's just a little spasm, nothing to worry about. Hey, word is the consequences of the Obama health care bill are already kind of showing up in the workplace. What can we expect from this?
No, they're not what you want to hear. But guess what? The cost of health care stand is going up. What you're going to see is that because we now have health care for children up to age 26, that's driving up the cost of family health care. Companies are reporting they expect health care costs to increase just under 9% this year, so they're increasing their employee premiums and those copays.
Does the same thing apply to prescription drugs?
Yep. Truth of the matter is, it isn't going to get any better. The most common approach those companies are taking is to offer what they call a multi-tiered prescription drug program. So if you want generics, guess what? You'll likely have a smaller copay, perhaps no copay at all. If you'll go with what they call preferred brand name drugs, copays and prescription costs will be higher, but they won't be as high as they will be if you insist on nothing but brand name drugs. That'll be the highest. Some companies are also implementing a step therapy. That is, your doctors are going to have to be pre-approved, so they try to offer you lower priced drugs first, and if those don't work, then the companies will approve the higher, more expensive drugs.
Can you give us some tips, what you know, on ways that we can save money on health care?
Yeah, a couple of simple things to do, Stan. First of all, those drug prescriptions, use those online and those mail-order pharmacies for medications you take month after month. They often do cost less. Generally, they're covered all or at least significantly in part by your health insurance. And Target and Walmart have great selections of generic drugs for $4. Check out a website, shopping.destinatorrx.com. It's destination.com. It's just a place to look at for the price of drugs and all kinds of things about drugs. Ask your doctor for free samples. They get them, they give them away, and grocery stores and pharmacies quite often have free prenatal vitamins. Ask about those. Avoid the emergency room unless it's life and death. You know, a visit to a clinic or a doctor's office will likely cost you $100 to $150, but going in the ER, $600 on average. And those doc-in-the-box, you know, those 24-hour clinics you see and pharmacies that have doctors on staff, those are usually less expensive than a regular doctor's office visit. So if you need a flu shot or you've got a sore throat, try going there first. And, you know, those glasses you see pretty much everywhere, they're $10, $20, they work. If you need a prescription, go to a doctor, get the prescription, but once you know the strength for your eyes, go buy those $10 glasses. I've used them. Everybody I know seems to use them. They're believe it or not, they work just great. And then check your medical bills. Believe this. The healthcare industry says that their own studies show that 80% of all doctor and hospital bills have errors. 80%. And finally, the best way to save money on healthcare? Quit smoking. Cut back on the junk food. Exercise. Take a walk.
Amen. Amen to that.
And then when you hurt your back, go to the doctor.
Yeah. And Robin, Vince says that the reason he hurt his back is because he's been carrying us on this show for so long.
I'm telling you, he's the best. Well, Vince, I tell you this, you look great. I know that back surgery is not something fun, but you look awesome.
Watch him get out of the chair, though.
Yeah, all right. He's probably glad we're moving over to the bus stop forecast with